Today marks World Health Day, a day that draws attention to a topic of concern to people all over the world. The WHO theme for this year's Health Day is Our Planet, Our Health. The theme serves as a timely reminder of the inextricable link between the planet and our health as the burden of non-communicable and infectious diseases rises alongside growing incidence of climate-related challenges. To talk more about staying healthy and the importance of World Health Day, we're now joined via Zoom by Dr. Walter Willett, a physician and epidemiologist, professor of epidemiology and nutrition at the Harvard School of Public Health. Dr. Willett, a very good morning to you. Thank you so much for joining us. Welcome to the agenda.
Good morning, and really nice to be with you. Thank you.
Indeed, it's an absolute pleasure having you join us this morning as we thrust into the spotlight the issues around our health. What's the importance of staying healthy and eating healthy?
Even before the pandemic, most of the world, the United States, but also most of Africa, has been involved in a pandemic of obesity and diabetes. And that's just a precursor of what comes after diabetes, heart disease, kidney failures, many other conditions. So we were going into the COVID pandemic with a very unhealthy state in most populations. And what we found during the pandemic, that the people get the COVID because of a virus, of course, but if we are infected with COVID and we're unhealthy or have diabetes or hypertension, we're much more likely to get seriously ill and die. Of course, we were already, again, suffering from those conditions, and COVID was exacerbated and made more severe by being in an unhealthy metabolic state. And that's a function primarily of eating too much of unhealthy foods and not getting enough physical activity. If you would like, we could talk about what a healthy diet might be.
Yeah, sure. And having said that, what are some of the things that are readily available that people with limited economic options can do to eat healthier?
First of all, of course, the available foods vary tremendously across Africa.
Yeah.
The agricultural conditions vary, the traditions vary, but I would first look at the traditional diets of where you live, because those have been tested for thousands of years and have been shown to be at least reasonably healthy and put us in a better condition to survive. A healthy diet means balance, a healthy carbohydrate source. In many places, it would be whole grains like from millet or traditional African rice. Some places it might be bananas or plantains. Other types it might be root crops. But plenty of fruits and vegetables are always part of a healthy diet. And for protein sources, legumes and nuts, peanuts included, are very important. They're better to have as most of the protein sources rather than large amounts of meat. And for cooking oils, healthy cooking oils that would be liquid and in bottles are almost always better. So we put that together and it can be a really healthy diet. It doesn't include sugar-sweetened beverages and is very limited in modern industrial foods that are really designed for profit, not for health. The good thing is that we can enjoy the traditional healthy foods of our neighbors. Now, we have more transportation than we did in older days, so we can have a lot more variety and a lot more flavors and enjoy that. But we don't need modern manufactured foods. Those are largely, again, designed to make money, not health.
Okay. Dr. Willett, lovely chatting to you. Thank you so much for joining us. We certainly hope that this day will help us, understand how we eat will of course affect how we fight off disease. Thank you so much for joining us. All right, so that was Dr. Walter Willett, a physician and epidemiologist, a professor of epidemiology and nutrition at the Harvard School of Public Health. Now, before we wrap the show, let's go back to Sandton, where my colleague Mxolisi Masango is standing by. Mxolisi, over to you.
Thank you very much, Simpiwe. And we're still right here in Sandton. We have to wrap it up quickly. Still joined by Ambassador Stith, who is the non-executive director of the African Presidential Leadership Center. Ambassador, we have to wrap it up right now. Now, COVID is not gone yet. How must we make sure that we don't let our guard down?
The agenda for this year, our agenda for this year, your audience's agenda for this year is simple. Be healthy and you'll stay healthy.
Thank you so much for your time, Ambassador Stith. Well, that's where we leave it for this edition of the agenda. We've brought you all the experts and some of the demonstrations as well at the back of World Health Day right here on the show. It's been a great pleasure being with you this afternoon. The On Point team is also on standby to give you the latest in news updates. Well, Simpiwe is also just ready to wrap it up. That's the time that it is. Thank you so much for watching the program. Back to Auckland Park.
All right, and Policy, thank you so much for joining us. And now we wrap the show.